Good evening. Welcome to the meeting of the Skokie Board of Trustees for Monday, January the 3rd, 2022. With Skokie and the entire state of Illinois now in Phase 5 of the Restore Illinois Plan and the lifting of restrictions on in-person gatherings, Skokie Village Board meetings are in person in the council chambers at Skokie Village Hall, 5127 Oakton Street. Village Board meetings begin at 8 p.m. and will continue to be broadcast live on the Village's YouTube channel, as well as on Skokie Vision cable television channels, 17 Comcast, 25 RCN. Meetings are also rebroadcast on the cable channels in the weeks following each meeting, and the videos are archived on the Village's YouTube channel. As of August 30th, 2021, all individuals in Illinois shall be required to wear masks when indoors, including village buildings. Public comments may still be submitted to publiccomments@skokie.org. Comments received prior to the meeting or during the meeting will be provided to the village board and will not be read aloud. Public comments also can be mailed or hand-delivered to Skokie Village Hall, attention village manager's office, or placed in the exterior drop box on the west side of Skokie Village Hall. Each village board meeting agenda includes time for public comments, and individuals wishing to speak on an issue will be allocated 3 minutes to address the village board. At this point, I would like to introduce Village Clerk Pramod Shah, who will lead us in the Pledge of Allegiance.
I pledge
Allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Before calling the meeting to order, I would like to ask for a motion to permit Trustees Robinson and Sutker to participate remotely. Is there such a motion? Trustee Kuhn, seconded by Trustee Pure Slovan. Call the roll, please.
Trustee Sutker,
Here.
Trustee Robinson,
Here.
Trustee Kuhn,
Here.
Trustee Johnson,
Here.
Trustee Pure Slovin,
Here.
Trustee Klein,
Here.
Mayor Van Dusen.
Here. Trustee Robinson and Trustee Sutker will participate in this evening's meeting. If you wish to make a comment or a motion, please raise your hand high, and I'll do my best to find you in the galaxy of photos that we have on the screen this evening. Meeting will come to order, and the clerk will please call the roll.
Trustee Sutker,
Here.
Trustee Robinson,
Here.
Trustee Kuhn,
Here.
Trustee Johnson,
Here.
Trustee Pure Slovin,
Here.
Trustee Klein,
Here.
Mayor Van Dusen.
Here. The next item on the agenda is approval of the consent agenda for this evening's meeting. A motion is in order. Trustee Klein, seconded by Trustee Kuhn. Is there anything on the consent agenda? Yes.
I'd like to remove 8A and 11A.
Okay, 8A and 11A are removed. Is there anything else anybody would like to have removed? If not, call the roll, please.
Trustee Sutker,
Aye.
Trustee Robinson,
Aye.
Trustee Kuhn,
Aye.
Trustee Johnson,
Aye.
Trustee Pure Slovin,
Aye.
Trustee Klein,
Aye.
Mayor Van Dusen.
Aye, the motion passes. The next item is, in fact, item 8A, appointments. And I would like to introduce the candidates who have been nominated. This evening, we have with us remotely, and I'm not sure if anybody is here. If you are, and I call your name, please raise your hand. Karen Lisa Sherman. Dennis Rizzo. Dennis is a member of the Public Safety Commission. Karen, the Human Relations Commission.
Here.
Thank you. Elizabeth Demas from Quadrant 1. Thank you. James Specker. James had said he was going to join us this evening.
I'm here, Mr. Mayor.
Okay, thank you. Casey Deers, Quadrant 3. Thank you. Alicia Wartowski, Quadrant 4. The Honorable Edward Bobrick. There we go. James Bohm.
Here, it's Bame.
Bame, I'm sorry, excuse me.
That's all right.
Will Evans as chair.
Present.
Thank you. And I would like to introduce Abo Figueroa, who has volunteered to be an ad hoc member. Let me just mention that each one of these nominees has volunteered their time to begin this use of force review board. What I have done with the nominations is try to stagger the time period. Some have been 1 year. The Human Relations of Public Safety Commission nominees, the Quadrant nominees for 3 years, and the at-large for 2 years. When the 1 year is up, they would be up possibly for renomination, the same with the 2 year. The ordinance provides for staggered terms, so that is what I've tried to achieve here. Will Evans graciously has agreed to chair the commission. The chair is a 1 year appointment. Will also is the chairman of the Board of Fire and Police Commissioners. And I don't think there's anybody who is more well qualified to launch the commission, get it organized, and at the end of that 1 year, Will and I will discuss the future. But I very much appreciate the fact that he's willing to do this. I don't think there's anybody in the village who has quite the breadth of experience that Will does. He was a very successful businessman as the president of one of the major utilities. He also has a career in public life, having been the chairman of the Board of Fire Police Commission for, is it 5 years now, Will, or is it longer than that? How long have you been chairman of the Fire and Police Commission?
Lost count here.
10th year. I was off by just a little bit.
Maybe 4 years, something like that, maybe 3 years, and I've been on the commission a little longer. And I was on the Human Relations Commission before then.
Yes. And what I'm trying to do with Abel is he would be on the commission ad hoc, not having voting rights, but participatory rights. I anticipate that this commission is going to be data-driven and that there's going to be quite a bit of information that the commission will be taking up. So Abel would be able to study the data, and if a vacancy should occur and he should be qualified, then he would be able to step in and he would be up to date on all of the commission's, the information that the commission has at its hands. It's a little bit of an experiment, but I was very impressed with him in our conversation. And when I told him about my idea, he volunteered to accept the post. So a motion to accept the appointments would be in order. Trustee Klein, seconded by Trustee Kuhn. Trustee Johnson, did you have questions?
I think you answered it. I was wondering about the role of the ad hoc member. Do any other boards and commissions have? Or
This is a first.
this is the first, okay.
It's an experiment. I wanted to see how it works. This commission is going to be pretty unique. And because of all of the data that the commission, I anticipate, will be looking at, and as it gets going, I think it behooves us to have somebody on there who would be ready, if qualified, if one of the members of a quadrant leaves for some reason, and he's in that quadrant, then he could accept it, or if it's an at-large post, Abel would be able to accept that as well.
So he doesn't have a term length or anything, like that?
No, it's strictly voluntary. His term is up when he decides he wants it to be up.
Okay, thank you.
Sure. Call the roll, please.
Trustee Sutker,
Aye.
Trustee Robinson,
Aye, and thank you.
Trustee Kuhn,
Aye.
Trustee Johnson,
Aye.
Trustee Pure Slovin,
Aye.
Trustee Klein,
Aye.
Mayor Van Dusen.
Aye, the motion passes. Next item is a presentation, the comprehensive annual financial report, which will be presented by Jamie Wilkie of Lauterbach and Amon.
Good evening, thank you. Can you hear me okay?
We can.
Great. Well, thank you. As the mayor indicated, we have for presentation this evening the village's April 30th, 2021 audited financial statements. I want to start out this evening by really thanking Julian Prendy and the rest of the finance team. This is quite a labor-intensive process, as you can imagine, from start to finish. We start with planning meetings with village staff. We go into preliminary field work testing for the audit, final field work testing, and ultimately multiple draft phases. So certainly want to take the opportunity this evening to thank the village team for all of their hard work in preparing for the annual audit. State statute does require that the village undertake an independent audit each year. And so this evening, I'll provide just a brief overview of the results from our testing. Any of you following along this evening within the actual audit document, I will provide page number references to key items within the report. We'll start on page 9 of the document, which is a copy of the village's Certificate of Achievement for Excellence in Financial Reporting. This is an independent third-party review of the annual audit conducted by the Government Finance Officers Association, and really deemed the highest level financial reporting that any government entity can undertake. There is about an 1.5 inch thick checklist that we go through with village staff on an annual basis to ensure that the village's financial statements are presented in conformity with that program. And we're happy to report that the village's annual audit from the prior fiscal year did in fact receive that prestigious award. We have again submitted this year's audit to the program, obviously anticipating receipt of the award again for this year. If we flip to pages 12 through 14 of the document, you'll find the independent auditor's opinion. As I stated, the audit is required under Illinois state statute to be conducted once a year. And really, we have two goals as part of our audit testing. Number one, we want to ensure that the financial statements as presented are in fact materially correct. And that is indicated by the village's unmodified or clean audit opinion that we have provided for this year. As part of the audit process each year, we are also required to do an overall assessment of the village's internal control environment. So while we're not providing an actual opinion on internal controls, we are required to go through extensive testing, review of policies and procedures. We go through third-party confirmations, testing of detailed transactions and selections. And certainly this evening, we would have to report what we would call any material weaknesses or significant deficiencies. And I'm happy to report this evening that we had no such findings. So truly a clean audit opinion for this year. Immediately after the audit opinion, you'll find one of the most important sections of this document. There are well over 200 pages provided in the report, but pages 16 through 27 provide what we call management's discussion and analysis. As the title indicates, this section is in fact prepared by village management and serves as the executive summary to the document. So within these 12 pages, you'll find condensed discussion about major transactions for the year, overall increases or decreases in key transactions and figures from the prior fiscal year. Clearly, you'll see discussion on the impact from the pandemic as it relates to various revenue streams and also expenditures. So I do always encourage our board members to read this section in detail, again, provided on pages 16 through 27 of the annual audit. The last section I want to point out is the very last section of the document itself. That is provided on pages 163 through 194. And this section provides what we call the statistical section, where you will find all kinds of 10-year trend information for the village. Really a wealth of information at the back of the report. Again, I always encourage our board members to spend a little time in those schedules. You'll find 10-year trend information related to financial results, operating indicators, long-term debt, property tax history. Again, really a wealth of information provided at the back of the document, and that is one of the sections required as part of that Certificate of Achievement program. Again, I just want to reiterate, no internal control findings, a clean audit opinion, and certainly I'd like to open it up this evening to any questions that any board members might have.
Does anybody have any questions regarding the annual financial report? Thank you. Great job.
Thank you for having us.
Thank you. Good report. Next item on the agenda is report of our acting village manager, Nick Wyatt.
Thank you, Mayor and trustees, and good evening. Item A is in regards to a COVID-19 update. Mike Charlie, Skokie's Director of Health and Human Services, is at the podium and will provide a presentation.
Good evening, Mayor Van Dusen and Village Board. My name is Mike Charlie, and I'm the Director of Health and Human Services for the Village, and I have some brief updates tonight regarding COVID-19 and what our Health and Human Services Department is currently doing in response to the pandemic. So I wish I had all good news tonight regarding COVID, but as you all know, the number of cases not only here in Skokie but throughout the world have been increasing recently. In Skokie, we currently have over 10,000 cases to date. Our positivity rate has increased significantly since the last time I saw the board at 8.15%. I did throw, that was Cook County's rate as of, on their webpage today, on the state's webpage today, was about 17%. Our 7-day moving average number of cases is at 122 cases a day. The chart, and I think it's the next page, will sort of depict what that means, but it is the highest number of cases over a 7-day period since the pandemic started. I did throw up there Cook County ICU bed availability because that'll come into play when I talk about the order, the proof of vaccine order, which was issued last week by the Health and Human Services Department. But In Cook County, the bed availability is about 10%. And the threshold we want to keep is about 20%. So as we start to see the number of ICU beds diminishing, that's when in public health, you're really forced to take some sort of mitigation measures or action to combat the spread of COVID. So this chart right here, what you see in the blue is every single day since March 12th, 2020, the number of cases per day. And then the red line, what you see is a 7-day moving average. That 7-day moving average is sort of supposed to show like a slope or a pattern. And you can obviously see since right around Thanksgiving, we've seen a significant increase in cases in Skokie. I think we had 180, 90, almost 200 cases on the one day, if you can see that. So you can see that when I say that I wish I had all good news, I wish that we were down to levels we saw in June and July of 2021, but the reality is we're not seeing that currently. This is another chart that depicts the community transmission rate. Everything you see in red is considered high community transmission. And community transmission, one of the reasons it's important is it affects things like schools and administrators deciding whether or not they're gonna require masking, or whether they're not gonna require masking, or whether they're gonna require social distancing, or whether or not they're gonna have school at all, or have some sort of adaptive pause to protect their students. Now, they look at other things like the number of cases and number of outbreaks and things like that. But as you can see, our community transmission rate is over 1,400 cases per 100,000 over the last 7 days, it's significant. Now, remember, we're not an island. If you took a look at the rest of Illinois, it's going to look very similar to this, similar data trends. This is the United States as a whole. As you can see, we're all experiencing a very high community transmission rate at this point. I did want to provide some information, at least somewhat good news, is that Skokie still is one of the highest vaccinated communities in all of Illinois, with our vaccination rate for eligible individuals with one dose is over 90%. Of Skokie residents have received at least one dose of vaccine. And then if you compare Skokie residents to the state in regards to fully vaccinated individuals, you can see we're about 20% higher than the state. So Skokie residents have really responded very well to get the COVID-19 vaccine. And I think we should be really proud of that here locally in Skokie. So we've administered over 32,000 doses. We are offering weekly vaccine clinics. On Tuesdays, we're offering the Pfizer vaccine for 12 plus. Of course, the FDA has approved boosters for 16 plus. Today, the FDA actually recommended lowering the age for the Pfizer vaccine for 12 to 15-year-olds, but we first have to wait for the CDC to approve that. So I'm guessing within the next couple of business days, the CDC will make a decision on that. In addition, the FDA made a change today where they're going to recommend booster doses instead of 6 months after the second dose of vaccine for Pfizer or Moderna or for Pfizer, to reduce it to 5 months so people can get the booster dose earlier. We do offer Pfizer 5 to 11-year-olds on Wednesdays afternoons still, and we offer the Moderna dose boosters and regular doses for 18 plus on Thursdays. Johnson & Johnson, we just don't have as much demand for that, but it's available upon request. Now, I wanted to talk a little bit about Omicron. This is going to be boring stuff, but, as of December, about 3 weeks ago, we were told the CDC said about 76% of the cases were Omicron and the rest were most primarily Delta. And then just recently they changed their tune where new data that was available to them said that about 59% of the cases were Omicron and about 41% being Delta. This is what the CDC is saying now. Now, just like everybody else in the room, you know, as I'm driving my car or as I'm looking online, there's all sorts of studies out there, right? That say that Omicron there's less hospitalizations, it could be milder in symptoms. But really, outside of a few studies done in like the United Kingdom and Israel, it's still not 100% known yet exactly the characteristics of Omicron, but this is what the CDC website said today, is it's known, it's not unknown at this point whether Omicron causes more severe illness than the previous Delta strain. Current vaccines are expected to protect against severe illness, hospitalizations, and death. As we all know, I think that with the initial strain of the virus, the vaccine was really effective. And we are seeing breakthrough cases with Omicron and Delta. But I think that the most important thing and the most important message for the public is that almost everybody being hospitalized is unvaccinated. Almost everybody dying is unvaccinated. Almost everyone on ventilators in the hospital are unvaccinated. So even though it might not be protecting you as well as previously, I think the message is that vaccines are still an effective way to prevent you and your loved ones from being hospitalized. So I wanted to move on to a proof of vaccination order. So back on December 21st, the city of Chicago issued their proof of vaccination order. And then sort of the dominoes started to fall, and Cook County issued it on December 23rd. And of course, the first thing I did when I found out about it, because the city of Chicago did this in sort of a vacuum, was I picked up the phone and I called Cook County. Then I called Evanston. Then I called Oak Park. Then I called Stick. I went through all the local health departments and we kind of discussed it. And really, we all agreed that with the percentage of ICU beds decreasing and the cases just skyrocketing, something had to be done. So to help stop the spread of COVID, these orders require certain establishments to verify that patrons are fully vaccinated against COVID-19. And this order will remain in effect in the village of Skokie through this Omicron-driven surge until the risk of overwhelming hospital capacity diminishes. And we see sort of a reverse trend in the number of cases, or at least it get better. So what is the overview of some of the mitigations this requires? So it requires that to enter a qualifying establishment, and those establishments are primarily restaurants and anywhere where food is served for consumption on premises, and fitness centers. Those individuals over the age of 5 have to be vaccinated. Businesses have to require that people show an ID if they're over the age of 16 and show proof of vaccination. And I'll provide some information on proof of vaccination on the next page. Businesses are required to post signage. Employees at those businesses either must be vaccinated or they must get tested weekly. And businesses must develop a protocol for providing details on how they will enforce this order. I did want to go back to originally Chicago had their order effective today. Cook County followed suit, and then when I had a conversation with Evanston and Oak Park, we thought giving the businesses an additional week to prepare would be a good idea. So we pushed back the effective date by a week to assist our business community to prepare. So individuals can show proof of vaccine directly through their CDC vaccination card that all individuals should have gotten when they received their first, second, and booster doses. And an official immunization record from a jurisdiction, state or county. There are digital applications like the Vax Verify, which I'll show you on the next page, which anybody can register to actually get a record of their vaccine information. Or you could take a digital photo of your actual card and show it to the business. This is an example of what it looks like on Vax Verify. This is actually my record. You can add your kids. So this is my 3 kids. I don't think I can add my wife. She can do her own. But you can see I have my 3 kids, my 2 15-year-olds and my 12-year-old, and on the right there is my vaccination records. Now, what you see there are my 3 COVID doses, but below that, I also have a list of some of my other vaccines. So any vaccine with like flu vaccine or some of the other required vaccines will also show up on here. Now you can print this out and you can bring it into the restaurant and show that to them, or bring your vaccination card with you. So that's the quick version of the order. So effective next Monday, Skokie businesses will be required to follow that. I have had a lot of questions about enforcement, and I will say that I'm not in the business of being a police officer. We're really more about education in this community. And if we have any businesses that aren't complying with the order, the first thing we're going to do is help them. You know, we're going to go out, we're going to provide them the information they need to understand what's required of them. I know this isn't easy for businesses, you know, and I feel for businesses. So we'll do everything we can to help them out. So isolation and quarantine guidelines. So some of that has changed recently. And I wanted to go over just really as quickly as I can. This gets a little complicated, but essentially the CDC has recommended recently, and the Illinois Department of Public Health has endorsed it and picked it up as a guideline, that the isolation period and quarantine period for certain individuals can be reduced from, for like quarantine from 14 days to 5 days, and for isolation from 10 days to 5 days. However, certain criteria needs to be met. And this is where it gets a little complicated, but I'll try to run over it as quickly as I can. For isolation, after 5 days, if you test positive or on your first symptom date, if after 5 days you're asymptomatic or your symptoms no longer are occurring, you can remove yourself from isolation. And what you can do then is mask for another 5 days. So you can go to work and mask, try to socially distance. And that they are saying that the science says that is safe. For quarantine, if you were exposed to somebody as a close contact and you were boosted, you have your booster dose, then you do not need to quarantine. But you should test on day 5 after your last known exposure. And that's a PCR test. That's not the at-home antigen test. And you should mask for 10 days. Now, if you have not been boosted, you are required to quarantine for 5 days. And after 5 days, you are supposed to go get a PCR test on day 5. You can return to work, and of course, if you test positive, then you have to isolate. So, some significant changes. Now, these changes don't affect school and don't affect some other settings. They still have to follow the Illinois State Board of Education guidelines, which is a little bit different than this. But this is where we work really closely with our schools. I can't, a big shout out to the Health and Human Services nurses and staff, because we are constantly busy downstairs. I haven't had a day in 2 years where I'm not go all day. And I know my nurses are the same way. District 219 has taken an adaptive pause because of the number of cases with their staff. They just can't staff the building. So they're going to take an adaptive pause where they're doing remote learning through January 14th. We also provide a ton of consultation to the schools. We are constantly on the phone with their nurses, constantly on the phone with their administrative staff. Just for an example, and I just throw out one example, there are 9 different sports teams at one of our schools that have taken an adaptive pause because of outbreaks. One school, 9 outbreaks at different sports teams. So just multiply that times all the rest of the schools and all the different activities, and you can see how busy we are, because we're constantly providing them consultation on that. Ultimately, though, the schools have the authority to make those decisions. You know, we provide them consultation, but they can decide whether they're gonna, move school to remote learning or pause things in other ways. Okay. I think that's all I have for tonight. but I can certainly answer any questions that the board members may have.
One of the things I would point out is that the schools are in the Park District and library are likewise. They're determinative in and of themselves. If they decide to adopt certain protocols, that pertains to their organization, regardless of our order. But
Yeah.
have you had contact with the library or the Park District?
I actually had a meeting with the executive director of the Park District this morning
Oh,
about the
okay.
order, and also with a couple other individuals, not with the library. But the order really doesn't apply too much to the library, more the Park District,
Right.
because of their fitness classes. But yeah, I've been providing them some consultation, Mayor.
Right. Thank you. Anybody else have any questions or comments? Trustee Sutker.
Thank you, Mike, for everything that you and the health department does. I was just curious about, I'm hearing some things out of Israel about a fourth booster. Have you heard anything regarding that?
I haven't heard anything about I've heard that there's some research being done and that it's certainly a possibility. Other than that, I haven't read much on it, Trustee Sutton.
Breaking news. This evening, there was a report posted that the health minister in Israel is recommending a booster for anybody over 60 or anybody who is immunocompromised. But that was done late this afternoon.
Thank you.
Trustee Robinson.
Thank you so much for the information and wow, how dramatic the numbers are. I was wondering if we had any numbers in our community of the spread in children.
So I didn't bring that slide with me tonight, but most of the cases that we're seeing are, so in the beginning of this pandemic, if you looked at the data, most of the cases were individuals 50 and above. But if you look at the data now, most of our cases are 30 and under. So we are seeing our largest percentage of cases are amongst the individuals like 20 years and younger at this point, which is disturbing. I will say this, though, that you got to keep in mind that at the schools, most of our schools are doing some sort of testing, weekly testing of the students, which is helping because it's helping identify cases in those asymptomatic children. Otherwise, we wouldn't, like a year ago, we would have never known these children were positive. So I certainly think that's one of the reasons why we're seeing more cases in children than we had seen before, just because they're often asymptomatic.
Thank you.
Yeah, thank you for your ongoing support, everyone. Yeah, appreciate it.
Thank you for the hard work. Please share our gratitude to your entire staff. I've been down in your department, and your description is very mild. It's a torrent of activity. The phones are ringing constantly, and thank you for everything that you and the health staff does. We appreciate it.
Thank you.
Item B is in regards to an interior-exterior TIF rehabilitation program grant for complimentary cafe at 4933 Oakton Street. The village offers a downtown incentives program to attract and retain more retailers, restaurants, and other commercial users in downtown Skokie. Mr. Riaz Ali and his wife Noor Akawaja, Skokie residents and owners of Complimentary Cafe, have recently entered into a 7-year lease for the 1,200 square foot building at 4933 Oakton Street. The cafe will feature an inviting place to sit, work, and host community gatherings, and will rely on locally sourced food products and quality coffee and tea. The significant build-out of the cafe will include interior renovation and demolition, construction of 2 new bathrooms, upgraded plumbing and electrical, new flooring, counters, and a reception area, and other related equipment upgrades and improvements. Scheduled improvements for the exterior facade include painting and new signage. The total rehabilitation cost is approximately $84,430. The maximum grant under the village's program will be $44,353. Construction for the cafe will be completed in early 2022 and will open to the public in early spring. Within the first 2 years of operation, the cafe is anticipated to employ up to 10 full and part-time workers. I concur with staff's recommendation and respectfully request mayor and board approval of the interior exterior rehab improvement grant estimated at a not to exceed amount of $44,353. Leslie Murphy, Economic Development Specialist, will be at the podium to answer any questions. And I would also note that the owners, Riaz Ali and his wife, Noor Akawaja, are also in the audience tonight.
Good evening. Welcome. A motion to accept the manager's recommendation on an interior-exterior TIF rehab grant for complimentary cafe is in order. Trustee Pure Slovan, Trustee Kuhn. Does anybody have any comments or any questions?
Do we hear Leslie's presentation? You want to tell us about it?
I'm sorry, I didn't hear that, Trustee Klein. What was that?
Tell us about it.
So this is one of our pandemic pluses because we have had several new vacancies in the downtown as a result of the pandemic, of course. But this particular building has been vacant for way longer than the pandemic. And so we have been sort of wringing our hands for years because it's right across the street from a major redevelopment project that we hope is going to be implemented this coming year. And we've been talking a lot to the owners of the property right at the corner of Niles and Oakton, but this property was adjacent to it. And when these two came along last summer, it was just such a delight to spend time with them about their vision, their plans, how hard they've worked during the pandemic to come up with this concept. And they are ready to go. They have been working with the building department for several months now to get permits. And we just think it's a perfect opportunity to use TIF dollars to get a vacant space occupied and to help some entrepreneurs bring another coffee shop into the downtown. So we're excited.
I just want to say one thing.
Of course.
I just think it's a plus that they show the commitment to have a 7-year lease. So I think that's a great factor.
And there's a new owner here, and that's the other reason that we're excited. The prior owner had kept it vacant for a long time. And so this is a new partnership that we're happy to be involved in.
Call the roll, please.
Trustee Sutker,
Aye.
Trustee Robinson,
Aye.
Trustee Kuhn,
Aye.
Trustee Johnson,
Aye.
Trustee Pure Slovan,
Aye.
Trustee Klein,
Aye.
Mayor Van Dusen.
Aye. Riaz Noor, congratulations. Welcome.
Thank you.
We're very happy. We're very happy to have you. Look forward to having a cup of coffee together.
Oh my God, that would mean the world to us. Thank you, we're so excited.
Let Leslie or Vicky Varga in the back, let them know. We'll be there. We'll be there in force, I promise you. Congratulations and welcome.
Item C was approved under tonight's consent agenda, and that would complete my report.
Thank you. Report of our Corporation Counsel, Michael Lorge, is next. Item A was removed from the consent agenda.
Thank you, Mayor. Good evening, trustees. Good evening, everyone. Item A, as the mayor indicated, is an ordinance which was on my report for second reading tonight and was removed from the consent agenda. This ordinance will authorize the issuance of general obligation bonds for two purposes. First, an amount not to exceed $160 million is required to fund 90% of the unfunded portion of the fire and police pension liabilities as determined by the village's outside actuary. Second, an amount not to exceed $27 million is required to fund TIF-related improvements in conjunction with the previously approved hotel development at 4930 Oakton Street. Both the 2022 Series A and Series B will be sold as part of the same debt issuance in early January in order to meet funding deadlines towards the TIF project and take advantage of the underwriting expertise and market reach for both. Although the parameters ordinance establishes separate tax levy requirements for each series, repayment of the 2022 Series A will be made through existing revenue sources, including the current property tax levy. Repayment of 2022 Series B bonds will be made through tax increment generated by the project, and the parking lease revenues derived from the private use, that being the hotel, previously approved portions of the garage. You have in front of you, have received a memorandum dated December 15th, 2021 from the Finance Director, Julian Prendy, and Julian is here to answer questions. Mayor, I'd be asking for board action on this tonight.
A motion to adopt the ordinance providing for the issuance of not to exceed $160 million in taxable general obligation pension bonds, Series 2022A, and $27 million taxable general obligation bond, Series 2022B of the Village of Skokie. Motion is in order. Trustee Klein, seconded by Trustee Kuhn. Are there any comments or questions? Trustee Johnson.
I don't have any further questions. The only reason I removed this was because I don't consent to the second series. I just wanted to say of the two series that have been combined together, the first series, the pension obligation bonds, I really strongly support, and I really thank you, Julian, for preparing this for us. This seems to be a really forward-thinking decision. It's the second series that I don't support for particularly the support of the construction of a very large parking garage on what is now green space in downtown Skokie. But the larger series, I wholeheartedly support.
Understood. Thank you.
Are there any other comments or questions? If not, call the roll, please.
Trustee Sutker,
Aye.
Trustee Robinson,
Aye.
Trustee Kuhn,
Aye.
Trustee Johnson,
Since I support the first series and not the second, I will simply abstain.
Trustee Pure Slovin, Trustee Klein,
Aye.
Mayor Van Dusen.
Aye, the motion passes with one abstention.
Thank you, Mayor. That then concludes my report for this evening.
Thank you. Next item on the agenda is the 2022-2023 Cdbg hearing number 2, FY proposal presentations. And this evening, it's a special pleasure to put into the fire Dvorak Kirsey, who is our new Deputy Director for Neighborhood Services. And I might point out, this is her first day on the job. So, good luck.
Thank you.
No, welcome. It's a pleasure to welcome you to the staff. And Dvorak will make an initial presentation, and then we will invite various members of the proposing community to make presentations. Dvorak?
Tonight is the second public hearing to prepare for the village's Community Development Block Grant Cdbg programming for the 2022-23 program year. The first hearing held on December 20th reviewed the progress of the current year's projects and the overall objectives of the Cdbg program. Tonight's hearing will involve a brief review of village proposals for next year, but is primarily intended to give representatives of community organizations the opportunity to present their funding requests directly to the board. The board has received a memorandum and overview of the funding requests along with copies of the proposals. The next hearing for program year 2022 will be conducted on Monday, February 7, when budget recommendations will be presented and preliminary project allocations will be determined. By policy, the village encourages citizen participation at all Cdbg public hearings and particularly welcomes the input of low moderate income citizens who are intended to be the primary beneficiaries of this program. The village's entitlement grant for program year 22 is not known at this time. However, we may proceed with our typical public hearing schedule. The one-year action plan will not be finalized until the entitlement amount is specified by the U.S. Department of Housing and Urban Development HUD. The final entitlement amount will affect the caps for administrative expenses and public services. In addition to the new entitlement, we expect to use some unobligated funds that we cannot apply to construction projects. A small amount of program income will be available to impact the public services cap. At this time, our overall estimated program year 22 budget is $607,200. However, proposals from the village and community agencies total over $818,000, so reductions will be necessary. At this time, our overall estimated program year 22 budget, the Cdbg program is intended to be for bricks and mortar projects. Therefore, at least 65% of our budget must be allocated to construction, capital improvement, or rehabilitation projects, as that was the original vision of this program. Based on the village's typical funding distribution of maximizing the 20% administrative and 15% public services funding caps, the construction rehab projects will need to be reduced by more than $166,000, and the public services request will need to be reduced by more than $44,000. The February budget recommendations will be the result of considering each proposal by the necessity of the work, the requested funding amounts, Cdbg eligibility, and HUD's program administration expectations. Village proposals will be presented first, followed by any questions from the board regarding these proposals. Then agency representatives will be invited to give a brief overview of their funding requests for the coming year, with a 2-minute limit. Any new applicants who are not current grantees or new applicants representatives of existing grantees are asked to give a brief introduction of their organizations or themselves, in addition to providing a brief overview of their funding requests, with a 3-minute limit. The mayor will call the agencies in the order of the proposals as provided. If the board would like to follow along with the PDF of the agenda packet, please note that the overview summary begins on page 71. The village proposals begin on page 79. The public facility construction proposals begin on page 86, and the public services proposals begin on page 244. Since we alternate the presentation order each year, the construction rehab requests will go first, followed by the public services requests. That is all.
Thank you.
Mayor?
Yes. Trustee Sucker.
Yeah, thank you. I am a licensed clinical social worker employed by a social service agency that is an applicant for a Cdbg grant. I do not believe this creates a conflict. However, I believe it is important to avoid the appearance of partiality. Therefore, I will recuse myself from participating in the discussions relating to the applications and from voting on the grants. My recusal from participating in the discussion should not be construed as indifference to the valuable services that the applicants provide to people in need. I respect and admire all of the agencies for their fine work, especially during these difficult times with COVID. I thank all of the agencies for their work and dedication. Thank you.
Thank you. The first organization who will make a 2-minute presentation is the Housing Opportunity Development Corporation, Richard Honig. Richard?
Hello.
Hi, Richard.
Hi, good evening, everyone. I'm Richard Koenig. I'm the Executive Director of Housing Opportunity Development Corporation. HODC is a nonprofit organization that develops affordable housing throughout Chicago's northern suburbs. I'm extremely excited to announce that just this year, we bought our permanent offices located here in Skokie. So we're very proud to be a member of Skokie community. Our original buildings first purchased were in Skokie, and we still own and operate those buildings. This year, we are asking for funds to continue to improve our properties. HODC currently owns 6 properties within the village of Skokie, and we're looking to improve the security measures at 4 of those buildings by purchasing security cameras. To improve that security, those are costs that are beyond our normal scope of our operations, and it would be really important for us to help continue to improve the properties and maintain safety and security for our building residents. We're extremely proud to be a member of the Skokie community and continue to provide affordable housing options for its low-income residents.
Thank you. Does anybody have any comments or questions? Okay, you're expecting to have the office opening in May. Is that correct?
That's correct. We're hoping to have our grand opening in May. We're getting settled in, and hopefully if COVID accommodates us, we're excited to invite everyone to our grand opening of our building at the corner of Grosse Point and Lincoln.
Terrific. Look forward to seeing you in person.
Fantastic.
Hopefully.
That'd be great.
The second organization is no stranger. It's Turning Point, and Ann Rainey, I believe. Ann?
Mr. Mayor, I'm actually presenting for Turning Point. This is Jen Saltz.
Yes. Welcome.
Thank you. Hello, everyone. My name is Jennifer Saltz. I'm the Development Director at Turning Point Behavioral Healthcare Center. It's wonderful to see you all. Turning Point is an outpatient community mental health center serving approximately 1,300 clients a year, both adults and children beginning at age 5, approximately 90% of whom are low income. In addition to housing Turning Point, the Turning Point building also accommodates tenants, including NAMI, Cook County North Suburban, Heartland Health Centers, Mental Health America of North Shore, and Peer Services. Turning Point is applying for funding this year to replace one of our rooftop HVAC units, which controls heating and cooling in our Skokie Boulevard facility. With the very, very much appreciated support of the Skokie Cdbg program, we have been gradually upgrading our aging HVAC units over the past several years, and we hope to continue that process, prioritizing the next unit, which is in need of replacement. The HVAC upgrades we've been working on have helped to replace aging units that have been consistently problematic, resulting in repeated repairs, leaks, fluctuating temperatures, and poor energy efficiency. All of the new units are being installed with hail guards so as to maximize their lifetimes and better protect them through the winter and from the weather. And again, we're just so grateful to the Village of Skokie for supporting our work and all of the activities that take place under our roof. We thank you so much for your consideration this year, and Happy New Year.
Jen, Happy New Year. Great to see you. Thank you for coming this evening.
Thank you, Mr. Mayor.
Does anybody have any comments or questions of Jen? If not, thank you. Keep up the good work.
Thank you so much.
Mary Matt from Shore. I saw Mary up there.
Yes, I'm here. Hello, can you hear me?
Yes, Mary,
Okay.
Good to
How
have
are
you.
you, everyone? And thank you, Mr. Mayor, for having us this evening. I am Mary Matz. I'm Shore's Chief Philanthropy Officer, and Shore works with children and adults with intellectual and other developmental disabilities. We have been probably serving that population for 71 years as of today, which is our 71st anniversary. And obviously, Skokie is home to many of our residences, as well as our day program at a building I'm very well familiar with, and that is our Lois Lloyd Center, formerly the Skokie Police Station. Our day program at the Lois Lloyd Center works with roughly 80 adults who have severe to moderate and profound developmental disabilities. We do have a full-time nurse on staff because there are many clients that are medically fragile. And that program in particular offers developmental training. That's really in areas of self-care, socialization, pre-vocational skill development, and obviously our most important element is community integration activities. We serve roughly 400 clients yearly. The Lois Lloyd Center in particular served 78 clients last fiscal year, which would be July 1 through June 30th of 21. 41 of those clients are from Skokie, with an additional 41 Skokie residents that are served in other Shore programs. Our request this year is to continue to replace VAV boxes, or variable air volume boxes, which are basically dampers in the ceilings. There are 32 in the building. With the good graciousness of the Village of Skokie and Cdbg funding, we have replaced 18 to date out of the 32, which is 56% of all of the boxes. And really the biggest issue is that these boxes, many of them don't work. And we had replaced our control panel, and so these new boxes have direct digital controls, so that way they'll talk to each other, and it becomes a more efficient way of running our HVAC units, primarily because you bring in a lot of the fresh air, and then it can kick it out, but then like if they're not working, they don't regulate as properly. So we are looking to replace 10 of them this year with a request of $22,627 from the Village of Skokie. As I said, many of these boxes are old. They've surpassed the manufacturer's life, and changing them would obviously be a better way to regulate our building. And we use not only the upstairs for staffing for our clients, but other activities aside from what is done on the first floor, along with other meetings and intakes for other programs as well. So that is our goal, and we appreciate obviously the generous support we have received throughout Shore's history here, and thank you.
Mary, thank you. Are there any comments or questions? Keep up the good work.
Appreciate it. Thank you.
See you soon. David Guthridge, CJE Senior Life. I saw David up there. David?
Hi, good evening there, Jason and Village Board. It's really nice to see you, even though it's by Zoom. Happy New Year.
Happy New Year.
I'm David Guthridge, CJE Senior Life's Executive Director of Affordable Housing, and we're a diversified elder care organization whose mission is to enhance the quality of life and facilitate the independence of older adults. Our vision is older adults living better every day, connected to the community of their choice, with access to trusted care and a full range of services rooted in Jewish values. We offer programs in life enrichment, supportive housing and resources, healthcare, research, and education. And each year, CJE programs benefit 20,000 diverse clients and caregivers. Participants typically live in Chicago's north and north side neighborhoods and north and northwest suburbs, including Skokie. Most clients live close to or below the poverty line and receive free or subsidized services. Tonight, we seek $21,517 in Skokie Community Development Block Grant funds to purchase and install an intercom system and a magnetic hold-open system for doors leading to the suites at CJE's Robino residents. Robino is a HUD Section 8 housing for very low and low-income older adults. And this building is nestled within the Skokie community at 7550 North Costner Avenue. Robino Residence has 24 furnished rooms and is home to 24 mostly very low-income Skokie residents aged 62 and up. Almost 60% of the residents have annual income below $15,000, and nearly 40% are older than 80 years of age. Now, this particular funding will improve communications and enhance security and safety at Robino Residence by installing an intercom system that includes speakers in each of the suites, activity room, all the common areas, and because we presently lack the ability to simultaneously communicate with everyone, guests, staff, residents, this will allow us to quickly inform everyone to either evacuate, all is clear, or dinner is ready. We also plan to install a magnetic hold open system for the 6 doors leading from the suites to the rest of the building. Residents typically like to have that suite door open, but that's without the mag locks that conflicts with fire code. So this way, if the fire panel is triggered, the power is released to the mag locks, they all close, and we have a much safer situation for fire and smoke. These improvements, we believe, will benefit Skokie Robino residents, visitors, staff, and is aligned with the Village of Skokie Cdbg consolidated plan goals to support organizations that provide housing for elderly and the frail elderly, and to support projects that improve or expand services to low and moderate income Skokie residents. We're very gracious for your support in the past, and this funding has improved our facilities to provide safer and better quality of life for our low and moderate income Skokie residents. We very much appreciate your consideration of the request, and I'm happy to answer any questions.
Thank you, David, and a Happy New Year to you.
Thank you.
Comments or questions? Terrific. Thank you. Keep up the good work.
Thank you so much.
Corey Gum with Search. Corey?
Yeah, good evening. My name is Grace Lipscomb, and I'm the development manager at Search. Both Corey, our CEO, and I are present, and I will be presenting the information tonight. So it's really nice to meet you all. Search is a nonprofit organization that provides services for adults with intellectual and developmental disabilities that includes housing, employment, and clinical services, just to name a few. We currently operate 28 community group homes for individuals with disabilities throughout the city and suburb, and provide these services to over 350 individuals annually. The city of Skokie is a wonderful home for 85 of the individuals that we serve at 14 out of our 28 community residential sites. Here at Search, we take really great pride in maintaining beautiful and accessible homes that are very well integrated into the communities that they are in. And for many years, the Village of Skokie has been an extremely important partner for us in helping maintain and improve several of our community-based homes through your Cdbg program. So this year, we are respectfully seeking your request to renovate an accessible bathroom at our residential Scylla site on Kildare Avenue in Skokie. This home at Kildare is home to 6 men with developmental disabilities who are all very low income and rely on Search to help meet their basic needs. Your renewed support will significantly improve the accessibility of the home in many ways. This home serves men who are aging, some with mobility challenges, and this would allow them to easily ambulate in the bathroom and utilize all of their home's facilities. Many of the men, too, who live in this home at Kildare are long-term residents of Skokie, residing here for a decade or even 2. So overall, the addition of this renovated, fully accessible bathroom will allow for easier access in the home for all of the men and allow them to gracefully age in place over the next many years. So with that, we appreciate the opportunity to present this renewed request for your support. Thank you so much for your consideration. And as always, thank you for everything the Village of Skokie does for Search throughout the year.
Thank you. And thank you for everything that Search has done in the past for for the village. We very much appreciate it
Absolutely.
and look forward to
Thank you.
working with you in the coming year. Thank you.
Thank you so much.
Marlene Hodges from Orchard Village. Marlene?
Good evening, welcome, and thank you so much for the opportunity of telling you 30 seconds worth about Orchard Village. Orchard Village on March 2nd will be celebrating our 50th anniversary. And we're very excited to have, to begin to launch what we're viewing as our golden year. And thank you so much to the Village of Skokie for so much help over the years. I almost don't want to say it's a repeat of what the good people of Search just told you, but Orchard Village also runs group homes, and 5 of our group homes are in Skokie. One of the group homes is literally right next door to Niles West High School. And it is a handicap accessible home to 8 low-income residents. And as much as is humanly possible, we're asking for help in redoing 2 of the bathrooms, which are they're both handicap accessible and both in sore need of major redos. And I'm open to any questions, and I'm very, very appreciative of all of the support that the village has provided Orchard Village over the many years.
Well, and congratulations on the 50th anniversary. That's coming up in March, if I heard you correctly. Is that right?
That is correct, yes, March 2nd.
Terrific. Any comments or questions? Thank you. Keep up the good work.
Thank you.
That concludes the construction and rehab portion for the CDBG. 7 through 16 are public services. The first is Jcfs, Jewish Children and Family Services. Ruth Fruhoff. Ruth?
Hello, my name is Kathleen Gerhold, and I will be presenting on behalf of Ruth, who is now retired. Can you hear me okay?
Yes.
Great. Good evening, everyone. My name is Kathleen Gerhold. I am Assistant Vice President of Programs and Operations with Jcfs Chicago. We are grateful for the Village of Skokie CDBG program, which provides support of our financial counseling and case management services to low-income families in Skokie. Thank you for your consideration of this request. We offer financial counseling, emergency financial assistance, and benefits assistance to Skokie residents. We see people in our offices off of Golf Road in Skokie, and now that is a newly renovated 2-building campus where we offer a range of vital services, including mental health counseling and employment services. Last year, our program focused on meeting dire community needs due to the pandemic through emergency financial assistance and links to benefits. We served more than 100 Skokie residents and distributed close to $175,000 to meet community members' ongoing needs, which included rent, utilities, medical expenses, food, and other expenses. We received a generous COVID action grant from the Jewish United Fund of Metropolitan Chicago, allowing us to grant more than $2 million in emergency assistance funds all over the Chicago area, including Skokie, since the pandemic started. This year, we plan to return to our more in-depth financial counseling model as well and continue to offer financial assistance and links to resources and wraparound services. Our goal is to promote economic self-sufficiency, help people learn skills to budget, manage debt, handle stress around finances, and overall improve their financial functioning and circumstances. With the assistance of a financial counseling case manager, we plan to serve at least 40 to 50 people this year using the funds available through CDBG. The Village of Skokie Funds makes this work possible and provides caring services and relief to struggling individuals and families. We thank you so much for your support and continue to hope to be a partner in future years. Any questions?
Thank you, Kathleen. Are there any questions or comments? If not, thank you. Welcome. It's great having you this evening. Next on the list is Karen Fay, Center for Enriched Living.
Good evening, everyone. My name is Adam McCormick. I'm the Director of Development at the Center for Enriched Living, and I'm going to be speaking in place of Karen tonight. I want to thank the Village of Skokie, the Mayor, and the trustees for your longtime support of our work at the Center for Enriched Living. We've been active for more than 53 years, ensuring that people with developmental disabilities are fully included in the community, have opportunities to achieve personal success, and enjoy a good quality of life. Our new public service request is aimed at increasing access to economic opportunities for people with developmental disabilities by giving them the support and training they need to successfully join or rejoin the workforce. Prior to the pandemic, there was an 85% unemployment rate for individuals with developmental disabilities, a number which has unfortunately grown even higher during the past 2 years. We believe that work is more than a means for economic self-sufficiency. It offers important ways to contribute to and participate in the community, to build a network of social relationships, as well as creating lifelong learning opportunities. And we also know that people with developmental disabilities bring many wonderful skills and assets with them to the workplace that can contribute to the success of a business. If approved, we'd be using the Cdbg funds to support an employment specialist position who works directly with individuals from Skokie with developmental disabilities. The employment specialist is a critical partner in the employment journey of people with disabilities. They work with them to help assess their vocational preferences and work experience, assist in their job search and interview preparation, as well as providing consistent education and support to their employer. So we're very grateful for your time, interest, and longtime support. We hope to continue this wonderful partnership with the Village of Skokie and its residents with disabilities, and I'm happy to answer any questions that you have.
Thank you, Adam. Any comments? Thank you for being with us this evening.
Thank you.
Becky Ramsey, Asian Human Services.
Yes, hi. Thank you, Mr. Mayor, and trustees for considering our renewed Cdbg request and for hosting us virtually here tonight. My name is Becky Ramsey, and I'm here on behalf of AHS Family Health Center. We are a federally qualified health center operating 4 community health center sites, 2 in Chicago and 1 each in Niles and Skokie. Our mission is to provide quality and compassionate healthcare services to the Asian American community and all other underserved or underprivileged communities in a culturally competent and linguistically appropriate manner. This past year, we served about 12,000 patients across 4 sites, approximately 1,600 patients who live in Skokie. Our clinics provide integrated primary, behavioral, and oral health care to patients of all ages and include patients using Medicare, Medicaid, and the uninsured. Similar to the Village of Skokie, we have an extremely diverse patient population, and 84% of our patients report they're best served by a language other than English, most prominently Hindu, Urdu, Korean, Tagalog, and Vietnamese. This year, we are requesting $15,000 in Cdbg funds to support optimal productivity at the 8800 North Lockwood Avenue Dental Clinic. Across our 4 sites, productivity declined in Q1 and Q2 of calendar year 2020, and services decreased by 38% because of the stay-at-home orders and decreased foot traffic to the clinics. At the start of the pandemic, we were only providing emergency oral health services or teledentistry, which caused more than 90% drop in oral health productivity. Currently, we are providing almost all of our medical and dental visits in person, which, due to the ongoing challenges that we heard about earlier in the meeting, require extra precautions and appropriate staffing. Prior to the pandemic, we did expand our oral health program and increase the capacity of the Skokie Dental Clinic to include 3 dental operatories and a full-time dentist, in addition to having 2 primary care physicians on site that enable us to promote warm handoffs between the oral health and primary care providers. Our increased capacity maximizes the potential of patients to access preventative dental services at all of our clinics. Ours is the first and continues to be the only safety net dental clinic located in Skokie for patients who are uninsured, underinsured, or on Medicaid. If approved, CDBG funds will help us return our Skokie Dental Clinic productivity to pre-pandemic levels. We appreciate your consideration of our renewed proposal, and thank you and Happy New Year to everyone.
Happy New Year to you, and thank you for everything that you do, particularly the last couple of years. It's been a struggle for everybody, and thank you for everything. Does anybody have any questions? If not, Roxanne Nava, Metropolitan Family Services.
Good evening, Mayor Van Dusen and Board of Trustees. My name is Mary Elston, and I'll be presenting on behalf of Metropolitan Family Services. I'm a bilingual therapist, and I've been providing counseling services at Metropolitan for 6 years, and we're very grateful for the ongoing support the CDBG funds has provided our organization. We're requesting funds to continue to provide counseling services to the low-income residents of Skokie on a sliding fee scale. Clients that are seeking counseling services pay nothing in our general counseling program through this grant. Our staff is able to provide therapy services in English, in Spanish, and in Assyrian. We're providing telehealth services as well as in-person services. Again, we're very appreciative of the ongoing support this grant provides. Thank you very much for your consideration, and I'm happy to answer any questions.
Thank you. Metropolitan Family Services has been in Skokie about, what, 60, 65 years?
A very long time, yes.
Yes.
I'm forgetting what we first were. I remember that someone was giving me the history that we had merged. I think it was Mary Rose that was, if you recall. She used to present for the CDBG before retirement. But yeah, it's been a very long time that we've been in the community.
Well, welcome and Happy New Year.
Thank you so much. Happy New Year.
Thank you for being with us. Elena Larson, Impact Behavioral Health Partners.
Hi, everyone. My name is Chris Knoper. I'm the Director of Participant Services at Impact Behavioral Health Partners. I'll be presenting in place of Elena. Our request for CDBG funds is to support our employment services program operating in partnership with Turning Point, as well as our internal clinical team, to provide individuals suffering from persistent and severe mental illness with evidence-based, research verified employment services using that research-based model of IPS. Those services work with each individual on a one-on-one basis to identify their preferences, talk about their experience, and try to find a good fit between what they have the skills and experience to do and what they would like to do in the future, and find a job that can meet them there. The funds we're requesting would support one employment specialist, or partially support one employment specialist. Typically in a year, one employment specialist will serve 30 to 35 individuals. And our program, as of last year, had a placement rate of 68% of individuals in our program found a job that met their preferences. Because we focus so much on our participants' preferences, last year 90% of individuals who found a job through our program maintained that job, which is a very high retention rate for individuals suffering with a mental illness. And additionally, part of our program and how we find a good fit for our participants is to go out and connect with employers to find out what their needs are, to make sure that the clients that we refer meet the needs of the employers as well, and we're a partner to the employer community as well. And last year, we talked to over 1,200 employers in that search to find good fits for all of the individuals that we work with. Thank you so much.
Christopher, thank you, and thanks to Impact Behavioral Health. We very much appreciate everything you do. It's been especially difficult the last couple of years, so thank you. Christine McCall, Peer Services. Peer Services.
Hi. Pardon me. I'm Ann Brown. I'm the Development Director at Peer Services, and I am speaking on behalf of the organization this evening. I want to start by just saying how much we appreciate the partnership with the Village of Skokie. Peer provides substance use treatment for teens and adults regardless of their insurance status or financial circumstances. We could not do this without the support of public and private funders. Your funding helps us serve both adolescents and adult residents of Skokie, many of whom could not access services anywhere else. Since the beginning of school this fall, we have seen an influx of students from the now high schools, and we are very grateful to be able to support them in managing challenges with alcohol and other drugs. We've seen that many adolescents experienced increased challenges during COVID, and during this school year, they've started coming back to Peer Services. I'm pleased to let you know that in September, we opened a second site in Skokie, a co-location at Turning Point on Skokie Boulevard, that provides both adult and adolescent counseling. This location will make treatment even more accessible to Skokie residents. We also continue to offer treatment at our Evanston location and via telehealth. I also wanted to let you know that our Executive Director, Maureen McDonnell, is stepping down from her position this month. Our Clinical Director, Christine McCall, will serve as our Interim Executive Director. Maureen is leaving Peer on strong financial footing and in excellent shape organizationally. We're in the process of searching for our next leader, and we would love your help in getting the word out. I'll share the job description with Carrie, and of course, if you have any recommendations of candidates, we'd love to hear that as well. Your support for Peer Services helps low-income teens and adults in Skokie address their challenges with alcohol and other drugs and reclaim their lives. We greatly appreciate your ongoing support, and thank you for considering our request.
And thank you, and please give Christine our regards. We look forward to working with her in this interim period. And if there is anything that we can do, please let us know. And I will let Carrie know of the opening, and we'll see if we can be of assistance. Thank you.
Thank you very much.
Mark Parr. I saw Mark up there. Good evening, Mark. Happy New Year. The Children's Advocacy Center.
Yes. Good evening, Mayor and trustees, and Happy New Year. I am Mark Parr. I'm the Executive Director of the Children's Advocacy Center, and our center provides comprehensive services for children who are alleged to be victims of sexual abuse, severe physical abuse, or victims or witnesses to other crimes, such as domestic violence, other situations that we have dealt with our children who are witnesses to homicide, attempted abductions, just about anything that involves a child as a possible victim or witness, where the police or the police and Jcfs are involved in an investigation of those incidents. We will work along with them. Our work begins typically right at the beginning when the case is first reported. We help coordinate the investigation to minimize the number of times any child has to be interviewed. We provide specially trained staff who are experts in interviewing children, and then provide a whole range of supportive services for the child, his or her family, as they go through the court system and through therapy to help them heal from the trauma they've experienced. We are asking for help and support for our child and family advocate who works with children in the village of Skokie who are reported as possible victims. Advocates do a lot of that crisis intervention. They're the folks who accompany families to court, help link them to other services in the community, and really are just the heart of the agency, because they're that one constant person who families and children can reach out to when they need help and support. All our services are free. We are a 24-hour-a-day agency. We're on call at all times should a child be reported as a victim and be in a situation where they may have possible contact with the alleged offender, or where the police already have somebody in custody and have to make a decision on charging or releasing that person. So thank you for your support and partnership over the years, and I'd be happy to answer any other questions.
Mark, Happy New Year. It's good to see you. Hope that we'll be able to see each other in person soon.
Yes, I hope so.
Does anybody have any comments or questions of Mark? If not, Terry Suzak of the Harbor.
Good evening. My name is Terry Shevchuk. I'm the Government Grants Manager with the Harbor. First of all, I just want to thank the Village of Skokie for your support over the years. The Village has been one of our community partners for quite a while now, so we certainly do thank you for that. This year, we are requesting support to ensure our agency as a safety net and offset cost of services to Skokie youth. Specifically, this funding would support partial salaries for a therapeutic case manager, as well as an intake coordinator. The Harbor recently welcomed a new executive director, Melody Rose, who is with us on the call tonight. So I'm going to hand it over so that she can introduce herself and provide updates.
Good evening. Can you all hear me?
Yes, we can hear you. Welcome.
Oh, great. Thank you so much. Thanks so much to the Village of Skokie. I want to echo Terry's sentiments. It's been incredible to join the Harbor as a longtime partner from the Evanston and Skokie areas for the past 10 years, and been coming out to the Harbor as one of, during the most critical of times, to serve our young people who are in need of housing stabilization. The Harbor is proud to be celebrating our 51st year as we head into 2022. And during that time, we've been serving female identifying youth across the northern suburbs through our transitional programs, serving youth ages 16 to 23, through 18 months of supportive life skills as well as independent living skills. We also expand that to include pregnant and parenting teens and young people who may be in need of additional parenting supportive services, as well as longer-term stabilization through job readiness and employment services. We've recently, during the past year, begun a program in partnership with DOJ to serve both in prevention and intervention with victims of human trafficking. And for a long time, we've been known as the go-to emergency shelter for female identifying youth ages 16 to 20. And covering the scope of services bridging adolescence into young adulthood is critical, especially during this time of acute need, while housing and housing instability is changing, as you've heard throughout the presentation tonight. So we really appreciate the opportunity to apply for additional funding, and I also want to take a moment to shout out the Skokie Health Department, who has been an incredible partner in helping both expand vaccination access to our young people who reside in our Skokie programs, but also consulting regarding best practices for residential programs with Dr. Michael Vernon, a great consultant. So thank you all.
Thank you for being with us. And I hope if you have an occasion to be in Village Hall, please stop by. I'd like to meet and make your acquaintance and get to know each other a little better. It's great to see you. And Terry, thank you for everything you do as well. We appreciate everything the Harbor does.
Thank you.
The North Shore Senior Center, Tish Rudnicki.
Hi, I'm Jeffrey Honeywell. I'm the Director of Senior and Family Services at North Shore Senior Center, and I'm going to be speaking on behalf of the center. On behalf of North Shore Senior Center, I would like to thank you for your continued support of the programs administered in the Senior and Family Services Department. Your support helps North Shore Senior Center provide essential social services for low-income and vulnerable older adults living in Skokie. The Senior and Family Services Department at North Shore Senior Center serves 4 townships, New Trier, Niles, Northfield, and Maine townships, as well as the city of Evanston. And in Skokie, we served in fiscal year 21, we served 4,731 Skokie residents. Older adults living in Skokie who receive support through North Shore Senior Center have a wide range of needs, including inadequate nutrition, lack of access to medical benefits, and an inability to provide for the full range of their activities of daily living. North Shore Senior Center is the only state-approved provider of the community care program, which provides in-home services and other services to help people remain in their homes. We complete a comprehensive needs assessment, which evaluates a person's ability to perform activities of daily living, their mental status, medical conditions, nutritional status, social support systems, access to transportation, spiritual support, as well as financial and legal needs. Using the information gathered in our assessments, we are able to connect adults to a wide range of services, whether it be in-house or outside referrals. These referrals meet the person's individual needs. For example, if an older adult is having trouble meeting their nutritional needs, they might be connected with SNAP benefits, food pantries, or in-home delivery services or home-delivered meals. We offer a wide range of supports, including support groups for older adults and their caregivers, connections to financial assistance programs like energy assistance, and benefits counseling. COVID has disproportionately impacted older adults and increased anxiety and isolation. North Shore Senior Center has worked diligently through this crisis to ensure that the older adults living in Skokie have the supports they need to age in their homes with dignity for as long as possible. I'd be happy to answer any questions, and again, I thank you for your continued support.
Thank you. And thanks to the North Shore Senior Center for everything that you do, not just for Skokie, but for the entire catchment area. We wish you a happy New Year, and we appreciate everything. Thank you.
Happy New Year.
And then concluding this evening with Wings, Letitia Fiorito.
Nicely done. My first name or my last name, or both, usually get butchered, but so thank you. Yes, my name is Letitia Fiorito, and I am the Government Relations Manager with Wings. And I would like to thank the Village of Skokie for inviting Wings to come back and to apply through this process. As many of you know, Wings' mission is to provide housing, integrative services, education, and advocacy to end domestic violence. Wings is seeking $8,000 to assist the Skokie clients served through Wings Suburban Safe House and who are receiving counseling services. Over the past 37 years, Wings has grown its mission beyond serving homeless individuals by focusing our efforts to serve individuals and their families suffering from homelessness due to domestic violence. Wings prides itself on making sure that we have a continuum of housing services that are able to meet each client where they're at mentally, emotionally, and financially. Through 2 safe houses, one in the suburbs and then one in the city of Chicago, each having the capacity to house 45 individuals for 90 to 120 nights. We also have 54 units of transitional and permanent supportive housing. And recently, in fiscal year 21, Wings added 110 rapid rehousing units. Through Wings' transitional housing program that allows approximately 2 years of housing and integrative services, so they may exit our program as a self-sufficient, competent individual. 4 of those transitional housing units have been in Skokie for more than 10 years. In addition to the individualized housing, individualized housing, meaning we have housing that meets each client where they're at. Wings provides the integrative services that include, but are definitely not limited to, case management for both children and adults, therapeutic counseling through a trauma-informed lens, transportation, advocacy for housing, education, childcare, employment, and legal, and of course, items to meet daily needs. In fiscal year 21, Wings provided over 65,000 nights of shelter to 756 clients. While only 5 of those clients, those 756 clients, were from Skokie, collectively, those 5 clients received 475 nights of emergency shelter. Also, Wings hit a milestone during the fiscal year of 21 by serving its 1 millionth night of emergency shelter, which, while we would like to think is awe-inspiring, it's also still what it is. We still haven't ended domestic violence. Then lastly, I would like to mention that during the fiscal year of 21, Wings piloted a program called Survivor Lifeline. Survivor Lifeline has been a dream of our CEOs for almost a decade. Survivor Lifeline offers existing clients a mentor from someone who has graduated from Wings programming. The mentors serve as an additional support and resource to that client, because Wings has learned over its history of 37 years that the best person, despite how educated and how trained our staff may be, is to have someone that can walk with them who has truly been in their shoes. Due to the infancy, of course, of this program, we do not have numbers to report it yet. However, I can assure you that all clients across agency, and of course the residents of the Village of Skokie, are eligible to receive that mentor. Again, I would like to thank you for considering funding Wings, and I'm happy to answer any questions.
Does anybody have any comments?
It wouldn't be a Zoom if there wasn't an animal, I suppose.
Letitia, thank you very much.
Thank you very much. And you're in good hands with Dvorka.
Yes, thank you. Thank you. I want to take just a moment on behalf of my colleagues to thank each of the 16 organizations who joined us this evening. One might ask, why have 16 organizations tell us about themselves? And it's because I think that we all need to be occasionally reminded about the heavy lifting that these organizations do. They do it outside of the limelight. The nature of their work is private. They deal with people in our community who have the greatest needs. And these are the people who need the service the most. We're grateful to the work that each one of you does in your individual areas. And together you comprise an important infrastructure of service for our community. Thank you for everything. Our departments look forward to continuing to work with you, and we will do our very best to be helpful to you through the Community Development Block Grant funding process. We're grateful to you, and it would be remiss of me if I didn't point out that it is always predictable that it's going to be one of the coldest days of the year when we have this meeting. However, this evening it was done remotely, so hopefully it didn't inconvenience and chill too many of you. Thank you very much for being with us. We look forward to continuing to work with all of you. And then this evening we conclude with public comments. Is there anybody who wishes to address the village board? Yes, ma'am.
I have a question. I didn't know how this works, so I wanted to know if we're allowed to ask questions during other people's presentations, or can we just listen to you guys deliver?
No.
Okay.
You just need to let us know when you want.
My apologies.
No, that's okay.
Next hearing, or?
Would you come up to the microphone? If you don't mind giving us your name.
Not at all.
Thank you.
Sure. Hi, my name is Dina Rubaha. I'm a resident of Skokie. I actually had questions during the COVID update section, so my apologies. I didn't
I read the instructions and they said to wait till the vote part,
Oh.
and then then they asked for the audience, and it didn't happen, and I kept waiting.
No, sorry about that.
No, that's all right. I don't know if I should direct my questions back to Mike, direct my questions, or if I'm just supposed to comment versus ask questions.
You could do whichever you like. You've got
Okay.
3 minutes to
Awesome.
address the board.
So I would love to hear more dialogue, starting from the percentage of residents vaccinated and with 1 dose versus 2, and what happened in that difference. I wanted to understand the dialogue about cases versus hospitalizations versus ICU capacity, and how that ties into the cities, not just ours, but other cities' ordinances, to ask people to not go places. So if you are seeing cases and cases are surging in all age groups, I would like to know if ICU capacity is being used up by all age groups, and what percentage of age groups are in an ICU capacity. Is the hospital filled with every age group and a disproportionate amount in certain age groups, and therefore we're asking certain people not to go to places? If you say that ICU capacity is the cause for the ordinances, then I'd like to understand if it's a certain subset. So then if it's 65 and older of the ICU capacity, then do we ask that 65 and older to be the individuals that show their age and do not enter establishments for a period of time until ICU capacity goes down? So I'd like to understand and then the action on the cases. So we all understand that COVID is actively spreading, will continue to spread, and we have no way, as we understand it, to control the spread, right? That's a separate piece of the dialogue. There is in fact no way to offset the spread, except actively limiting the movement of people, which we have to collectively understand is not a permanent solution, because then you would have to ask everyone to consistently stay at home, not go to work, not go to school, not go out, not engage in any activity, and that even then would
Nobody's
not...
saying that.
Yes, of course.
Nobody's saying you shouldn't go to work or...
No, of course. I'm
or
just saying
anything.
the point of the dialogue that there is no collective way to offset this. There are ways to slowly slow it down by a little bit, but we're seeing that it still moves in cycles. It went down and it's rising back up, and I feel like that's never part of the exchange, and I'd like that to always be in present. And then also, are there spaces like this where the health groups of every city are in dialogue discussing this, right? Discussing what we're seeing in hospitalizations, what we're seeing in age brackets, and are those spaces open for citizens to go to and listen and to hear that information? I think that's all of my general notes right now. And if there's a place there I can get the answers to those questions, that would be great.
If you would like to give me your name, and if you like a phone number,
Sure.
I could have the Director of Health, he was here this evening, and
Yeah, he's right there.
yeah, perhaps you could exchange
Sure,
and
happily.
arrange to talk to each other.
That would be wonderful.
I can give you a little bit of information. The percentage of fully vaccinated Skokians eligible for the vaccine, which is 5 years and up, is almost 82%, 81.9%. Illinois, at the time of this recording, was 64%, which is fairly close to what the United States is as a whole, 65.6%. And Mike can give you the dialogue you're looking for.
Wonderful. That
So
would be
be
great.
happy to.
Thank
Sure.
you. So I'll talk to Mike.
Oh, sure. And
Yes.
if you attend a meeting and you would like to speak on an issue that we're taking up during the meeting, just, give me a little signal and I'll be glad to recognize you.
I will do that in the future. I really read the
Good.
instructions multiple times, and I missed that window.
That's fine. We'll,
Appreciate it.
next time, we'll make sure.
Absolutely. Thank you very much.
Thank you. You're welcome.
Yeah, I'm going to provide public comments as well, so I'm actually
Gonna leave the dais for the remainder of the meeting and speak.
Well, why
from the-
don't you stay there?
That's okay. I'm gonna speak from the podium as a normal resident, not as a trustee, just as a resident.
Okay.
Hi, good evening, everyone. My name is James Johnson. I live on Hull Street in downtown Skokie. My comments this evening are about environmental sustainability. As you are all aware, the village's sustainability plan, our 5-year plan, covered the years 2016 to 2021, and sadly, we've now entered 2022 without a new sustainability plan ready to go. We are still in the beginning of what many environmental scientists call the decisive decade for climate action. We're being called to act with urgency to reduce greenhouse gas emissions in the community and to better integrate sustainability into everything we do. And so for me, entering 2022 without a new sustainability plan for Skokie is a clear sign that we're not doing as much as we can. So tonight, I'd like to make 3 environmental policy suggestions for the year to come, goals that are perfectly achievable in 2022. First, we need a very clear timeline for the creation of our next sustainability plan, which will be covering the years 2022 to 2027. This new plan needs to happen soon, and I hope the process will allow for community input and participation. Second, we also need a very clear timeline for the new chapter of the village's comprehensive plan, which will focus on environmental sustainability. Our environmental review process for development is lacking. And like our new sustainability plan, the sooner we get this new chapter of the village's comprehensive plan, the better. Third and lastly, our Skokie climate goals really need to match the regional climate goals that are included in the Climate Action Plan for the Chicago region, which was released last summer, which calls for net zero greenhouse gas emissions by 2050, with some pretty strong interim goals along the way. Without really clear, measurable targets for climate action, it's very difficult to prioritize climate goals and strategies. Without clear targets, we will inevitably fall behind some of our neighboring communities. Lastly, to conclude, I'd just like to say that just because we're still waiting for a new sustainability plan, just because we're still waiting for a new chapter of the comprehensive plan, does not mean that the village board needs to wait to act on sustainability. The results of the village's recent greenhouse gas emissions inventory has not been presented to the village board yet, but was presented to our Sustainability Commission. And so we already have a very good sense of where Skokie's emissions are coming from. The 2 main sources by far are commercial businesses and transportation. So any decision before the board involving commercial development or car culture really needs to be really thoughtfully examined from an environmental perspective. For example, you all remember that I believe that a greater examination was needed last year when the village board allowed Amazon to add an additional 1,700 cars a day to Skokie roads. I think a greater examination was needed tonight when the village board supported the construction of a very large parking garage on what is now green space in downtown Skokie. And I believe that it will be needed in the near future when the village board decides whether to allow Carvana to build a 130-foot tower of used cars next to a nature preserve. At this meeting and at the past 2 meetings, every single written comment that was received by the village board was voicing concerns or outright opposition to the Carvana project. It was 182 comments that we've received. So just lastly, we are in the decisive decade for climate action. I really urge the village to act with resolve and urgency in 2022 in regards to sustainability. Thank you.
Yes, as you know, the Sustainability Commission is working on making recommendations to the board. The important thing is that it be done well, not the time. This is January the 3rd. If it takes them to February the 3rd, but it's done well, that's the important thing. And I have every faith that they will produce a very good report. And the village has gone to some expense to do the emissions inventory. Very few municipalities have done that. It's a very difficult thing to measure. And when you talk about transportation, we're a transportation hub, which is beyond our control. But we also are the beneficiary of that. So I look forward to getting the commission's report, and the village board will act expeditiously, I'm sure, once we do receive it. So thank you for your comments this evening.
Thank you all.
Trustee Sutker.
I move we adjourn.
We are adjourned.